Hello. Have you ever stopped to think about the importance of recognizing the early signs of diseases that affect memory and reasoning? Today, we're going to talk about Alzheimer's disease, a condition that affects millions of people worldwide, and how to identify 5 important warning signs that may indicate its presence. Understanding these signs is essential for early diagnosis and for starting treatment that can significantly improve the quality of life for both the patient and their family. Early detection is crucial because the sooner the diagnosis, the greater the chances of effective intervention. So let's explore together these 5 key signs of Alzheimer's disease. The first sign that often appears is recent memory loss. This is not about the common forgetfulness we all experience, like misplacing keys. Instead, it's a more significant memory loss, where the person struggles to recall recent events, conversations, appointments, or even what they had for lunch. This difficulty in remembering new information can be an important indicator. It's essential to observe the frequency and intensity of these memory lapses. If they are increasing over time and interfering with daily activities, it's time to seek professional help. Secondly, we have difficulty with familiar tasks. Activities that were once easy, such as cooking, driving, managing finances, or even using the phone, become challenging. The person may feel lost in routine situations, struggle to follow simple instructions, or make mistakes they never used to make. Pay close attention if there's a noticeable decline in the ability to perform daily tasks, even with assistance. If this is happening, a medical evaluation is fundamental. The third sign is language and communication difficulties. The person may have trouble finding the right words, repeat sentences, or struggle to follow complex conversations. Writing can become illegible, or they may have difficulty constructing coherent sentences. Notice if communication is becoming harder, if there is excessive hesitation when speaking, or if the person is having trouble expressing themselves. This change in language skills can be a critical warning. Fourth, there is disorientation in time and space. The person may struggle to remember the date, the day of the week, the season, or even where they are. They might get lost in familiar places or have difficulty finding their way home. This disorientation may start subtly, but as the disease progresses, it tends to worsen significantly, affecting independence and safety. Monitor the person's temporal and spatial orientation carefully. Finally, the fifth sign is changes in judgment and reasoning. The person may make poor decisions, struggle to plan activities, or have trouble solving simple problems. Behavioral changes may also appear, such as impulsivity, apathy, or indifference. Loss of initiative and difficulty in understanding complex situations are symptoms that deserve special attention. Watch for significant changes in behavior, decision-making, and reasoning ability. It's important to stress that the presence of these 5 signs does not automatically mean an Alzheimer's diagnosis. Other medical conditions can cause similar symptoms. However, if several of these signs are present, especially if they are worsening over time, a medical consultation is necessary for thorough evaluation. A healthcare professional can conduct detailed neurological assessments, including cognitive tests, to determine whether there are signs of Alzheimer's and to rule out other causes. Remember, an accurate diagnosis is essential to begin appropriate treatment and provide the best possible support for the patient and their family. Don't hesitate to seek professional help if you notice any of these signs in yourself or someone you know. Early action is the best strategy. Now, let's take a closer look at each of these signs. For instance, recent memory loss, often the first symptom, to appear, can show up in different ways. It's not just forgetting where you left your keys, but repeating questions, struggling to follow conversations, or being unable to recall important details of recent events, even those with emotional significance. Watch if this difficulty is affecting the person's social and professional life, as this is an important indicator of severity. If you notice this in someone close to you, understanding the progression of forgetfulness is crucial. Share your experiences in the comments. This can help others recognize early symptoms. This brings us to the next sign, difficulty with familiar tasks. Losing the ability to handle routine activities is not just carelessness, but rather a gradual loss of execution skills. Imagine someone who used to be an excellent cook now struggling to follow a simple recipe, or someone who gets lost while driving on familiar routes. These challenges can be frustrating both for the person and their loved ones, making emotional support essential at this stage. Similarly, language and writing difficulties go beyond occasional lapses. They may include trouble finding the right word, replacing it with inappropriate terms, or failing to form complete sentences. Imagine the frustration of not being able to express thoughts clearly. Written language can also be affected, with handwriting becoming illegible or ideas on paper poorly organized. Tracking these communication changes is valuable for diagnosis and treatment. Disorientation in time and space is another symptom to monitor closely, as it can greatly affect autonomy and safety. It's not just forgetting the date, but also getting lost in familiar places, failing to recognize close people, or even feeling lost inside one's own home. Creating a safe, familiar environment can help minimize confusion and distress. Keeping track of these orientation issues and reporting them to the doctor is very important. Finally, changes in judgment and reasoning can manifest in many ways, from impulsivity and lack of inhibition to an inability to make sound decisions. The person may experience sudden mood swings, apathy, or indifference. Watch carefully for significant behavioral changes, as these may be early indicators of deeper problems. Poor decision-making, such as reckless financial spending or sudden changes in routine, deserves special attention. Remember, early detection is essential for treatment. Today, we've explored 5 important signs of Alzheimer's disease: recent memory loss, even for emotionally meaningful events, difficulty performing familiar daily tasks, language and writing difficulties beyond simple lapses, disorientation in time and space, threatening autonomy and safety, changes in judgment and reasoning, with mood swings and poor decision-making. Recognizing these signs is crucial because early detection makes treatment more effective and helps improve quality of life for both patients and families. This is not about occasional forgetfulness, but about a pattern of progressive changes that impact many aspects of life. Monitoring symptoms, recording observations, and sharing them with healthcare professionals are essential steps. Don't hesitate to seek medical help if you identify any of these signs in yourself or someone close. Information is our greatest ally in this fight. Sharing knowledge and experiences strengthens the support network and raises awareness about Alzheimer's disease. To keep learning more about Alzheimer's, leave a like and subscribe to the channel. Did you enjoy this? Share it, comment your questions, and subscribe for more insights on Alzheimer's. And remember, prevention and early diagnosis are vital. In the next video, we'll explore strategies to support those living with the disease. Don't miss it.